My name is Yasaswi Kislovskiy, and this poster is titled Barriers and Facilitators for Prevention and Treatment of HIV and STDs Among Individuals Who Exchange Sex. We know that STD rates are rising nationally and that certain populations combat higher risk for STD and HIV, and this includes people who exchange sex. We also know that this group has expertise on novel prevention efforts, screening recommendations, and communication best practices. With this work, our objective was to understand from the perspective of individuals engaged in exchange sex, their experiences with STD/HIV-related healthcare, strategies to protect against STD/HIV risk, and suggestions to improve care for people who exchange sex. Our methods employed qualitative and community-partnered approach. We conducted anonymous, in-depth interviews one-on-one, and with community partners, we designed our semi-structured interview guide, recruitment materials, and data analysis. We did purposive, snowball, and respondent-driven sampling, and we also used social media with Facebook and Twitter. We compensated interview participants and study team members from community partners. We coded interviews that were transcribed verbatim using an editing approach and then performed inductive thematic analysis, and themes were reviewed with community partners. These were our inclusion and exclusion criteria. These were our community partners. We interviewed 22 individuals. Median age was 26.5. We had a variety of self-described gender identities, including 4 people who were non-binary, and we had a variety of self-identified races, including 15 people identifying as Black. Thematic saturation was achieved after 17 interviews. Our first theme, healthcare communication, did not reflect nuanced, individualized decision-making. This first participant describes, okay, so like condoms are going to prevent STDs and that's great, but for me, I guess I feel like I'm going to get tested for STDs every 3 months, and most of the time the test comes back negative. But say like once a year one comes back positive. Then it's just a prescription for basically penicillin, and I just take a couple pills and that's the end of it. So I guess for me, not having to wear condoms all year long sort of justifies that risk that maybe I'm going to have to take a medication. Another participant describes, yeah, we visited that doctor for the pregnancy test, and when it was positive, the doctor was so happy, and that was not something she was prepared for. And I was not emotionally connected to her either. Another theme, despite healthcare trauma, resilient self-care and community building contribute to harm reduction strategies. One participant responded after being asked how do negative experiences with healthcare workers affect you, that at times it would make me hate the doctors, but also considering this is still a place I'm going to get help. I just try to calm down and just acknowledge that they are the only people that are going to help you. Another participant describes we get maybe good healthcare information by a doctor. I can share with my other sisters. Another sister goes to another clinic. She is given other information that she comes and shares. So with that rotation of every one of us having to go to a doctor and share with the rest of us, it's so informative. And finally, folks had novel ideas to improve healthcare that prioritize non-judgmental care, confidentiality, and lived experience. Instead of just, boom, here, I'm going to give you this. Okay, blood pressure is high, blah, blah, blah. Okay, what about your mental health? What about your safety? Ask them questions. How are you living? How do you feel today? Have you had a knife put to your neck in the last 72 hours? Have you used drugs and felt shameful for doing it? Ask questions like that. Don't ask questions like sometimes, often. You know what I mean? Have a drug addict write a freaking healthcare questionnaire for infectious disease. Have somebody in that situation, not somebody that reads it out of a textbook, because you don't know that life. So your questions are going to be corny and dumb, and ain't nobody going to want to sit there and answer them. Our limitations is that we were not including all representative identities and that our population does not reflect the adolescent group. Our strengths are that we had multiple identities, and this work was in the United States context. In conclusion, healthcare structures pose significant barriers to STD/HIV harm reduction amongst people who exchange sex, and including people who exchange sex could mitigate rates of STD/HIV in the United States. Thank you to all these people, and these are our references.